This year we published an article about the epidemiology of cancer in Angola because in Angola we doesn't have population-based cancer registry, and we use this data to try to analyze as a sample of cancer profile in Angola. According to the data, or according to the article that we published, the 10 most frequent cancers in Angola are breast cancer, cervical cancer, scapulosa, prostate cancer, and lymphoma. And our data showing that, for example, according to the stagement, the majority of patients were diagnosed in a very advanced stage. This is it's happening usually in Africa, yes. And our findings are showing, for example, in breast cancer, more than 50% of women with breast cancer had less than 14. This is very, very interesting because for us is a big problem because the test that we use for screening is mammography, and mammography is indicating for women that have more than 14, you know. And in Africa, specifically in our country, we have high proportion of women less than 14. But the problem is that mammography under the 14 is not feasible. This is the problem. Now we are trying to find another approach, for example, self-examination and ecography. Perhaps this kind of approach can help. Yes, now we are doing it in Angola. We are educating people for doing self-examination, and we are recommending them once per year to visit a doctor, for a doctor to do a self-examination and to teach them if they are, or to assess if they are doing well or not self-examination. We have a program about that in Angola now. Our patients, less than 1% had 20 years. This data is important for us to know at what age we can begin with screening of cervical cancer. I think in the absence of population-based cancer, this data can be utilized as a sample to try to analyze the profile of epidemic of cancer in Angola. But another finding of this research is that now we know where these patients are coming from, and we can use this data to collect data to implement the population-based cancer registry. The basic cancer registry is the next project. We are working on that now.